Welcome back to Stop Fainting Snippets and back to our favourite topic again of POTS. So we're just going to go around our table. This is the Imperial Syncope team and give you our recommendations for how you can manage your symptoms. So I'm going to start with an easy one, is make sure that you are hydrated, that your fluid replete. So you're drinking 2 to 3 litres of fluid a day, that you drink early in the morning. So we call front loading, so having most of your fluid by lunchtime to stop you going to the toilet later, and often to having a glass of water by your bed. So when you get up in the morning, you can have your nice cold glass of water before you get out of bed, because we know that sometimes your symptoms are worse. So that's my tip, is fluid.
I'm going to kind of modify that tip and say make the glass thermos and put 3 or 4 cubes of ice so the water stays cold. And if you have benefited from electrolyte tablets, something like the tablets that triathletes use on the training runs in the bottle, which is something you can get online or in health shops, then drop one of those tablets in the morning thermos, shake it up a bit, and in 2 minutes it all fizzes away. It's a nice tasting thing. Drink it, sit in bed for 5 minutes, do some breathing exercises, and then get on for the rest of your day. Trish?
Be proactive with your anti-gravity shield if your natural one isn't quite up to snuff. So isometric counter-pressure maneuvers, clenching your calves, your quads, your bottom, everything basically, and help when you change position. Think about not just being passive and waiting for the body to try and help itself, but you to be proactive by tensing up those muscles to try and return the blood backwards. So you can do that when you get out of bed, when you're in the shower, when you're making your toast, whatever you're doing, waiting for a bus. Just think about gravity and think about being proactive.
My top tip would be the pressure garments, the grade 2 thigh-length pressure stockings, abdominal binders. If you can tolerate them, wear them, because they will aid with the prevention of the venous pooling and return of blood flow back to the heart, which can help with your symptoms.
Should you wear that all day, Phil?
No, you should wear it perhaps during the day when you're up and active, maybe during exercise period. But when you're going to bed at night, you should take them off, because they're can be very uncomfortable for sleeping in, and probably won't do you much good at night.
It's a good idea to know your blood pressure. So you can have a look on our website about blood pressure monitors that you may want to choose, just so you can get an idea of what it is, if your blood pressure is low or normal, or you might find that you feel different with different blood pressures. And if you do have a low blood pressure, then eating plenty of salt and adding that to your fluid can be helpful. So adding it to your food, or if you don't like the taste, your GP or we can prescribe your salt tablets. And that helps you hold on to the fluid that you're drinking so that your blood volume is nice and full.
I'm going to take a slightly more complex turn on the advice now, which is to get the head of your bed slightly higher than the foot of your bed. And ideally have a couple of bricks or encyclopedias underneath the actual feet of the head side of the bed. So when you're sleeping with your head higher than your legs without you sliding off the bed, of course. And this is called orthostatic retraining. It does a few things. One, it causes your nighttime blood pressure to reduce a little bit. It minimizes the amount of urine production that occurs at night. And interestingly, it's a natural form of glucocortisone, because in sleeping like this for 8 hours every night, you will start to enhance the reabsorption of salt at the level of the kidneys. So think of it as a natural glucocortisone, which is a drug that will come on.
Maybe exercise, a structured exercise program, but with caution. Don't overdo it. Maybe pick the type of exercise that you're doing. Something, maybe swimming is good, as Dr. Lim has discussed in the past, because it will give a little bit of compression to the body when you're swimming and support it. Often find that is helpful, or an exercise bike where you're not having to sort of stand up. And when you do exercise, don't suddenly stop the exercise. Follow a warm down regime, gradually cool down, because this will again reduce the likelihood of venous pooling and keep the second heart, the calf pump, active.
Very good.
I'm just going to add to that, Phil, because we're on the topic of exercise. I think it's also helpful to push fluids before you exercise. We all tend to drink after exercise, but for the patient with POTS, having one of those isotonic tablets that you put in your beaker or bottle of water, ideally slightly cold, and drinking 400 to 500 mils before you actually exercise can enhance your exercise tolerance as well.
And remember to check out our snippet on exercise also on the website. I would also say, just picking up on what Trish said about your anti-gravity shield, be very careful about plan your day as to what you might be doing. So if you're going to have a shower, you may want to have a shower stool so you can sit down so you don't faint during the shower. Or if you know that you've got a long commute, you might want to plan it so you know you can get an early train or an early bus so that you can sit down so you won't be standing for hours. So think about what you're doing and maybe plan accordingly, more organised than you might have to be, so that you know you're not going to be upright for too long.
Know that you're not alone. So join a community, for example, potsuk.org, and know that you don't have to be fighting this disease all by yourself. The community spirit that comes from joining such a group can be very helpful and healing as well, and provide this element of education and knowledge that will empower your recovery.
Be patient with your doctors. So a lot of doctors might not know what POTS is or might have heard of it. The POTS UK website is a great resource for basically educating them and educating yourself and advocating for yourself.
Be patient with yourself, which is probably more important than being patient with your doctors. A lot of the times patients come to my clinic and say, when am I going to go back to work again, Dr. Lin? Is it next week? Is it next month? And that whole energy of that question underscores this weight of expectation and the mismatch between that expectation and your reality now. So be kind to yourself and actually be patient with yourself. It's a really important point that sets your sympathetic and autonomic tone in the right place for healing. So you want to come away from adrenaline and stress, come into relaxation and parasympathetic.
And talking of resetting your autonomic nervous system, see Dr. Lim's Boon's breathing demonstration also on the website, and other ways of resetting our autonomic nervous system, which may include meditation, gratitude, mindfulness activities.
I'd like to add that engage family, friends, and the number of times in my experience, a patient has gone out with a very close group of friends and family on a holiday just for a week or a weekend and has come back transformed and reinvigorated. Is so countless. So there's an element that goes beyond our day-to-day routine that if we step outside that and enter this autonomic mode, which isn't always pressured by the day-to-day need to prepare the household, for example, or your children for school, or your work, or preparing for that Zoom call, any of these routines that are highly autonomically driving, we switch that. We go for a walk in nature. We take a long weekend somewhere. We can dial down the autonomic nervous system.
Thank you, and see you again.